Hello everyone, welcome to my channel Human Diseases and Genes. In this video, I will discuss about Lesch-Nyhan syndrome. Lesch-Nyhan syndrome was first described by Michael Lesch and William Nyhan in 1960s. Lesch, a Swiss physician, and Nyhan, an American pediatrician, independently described the syndrome, which is why the condition is named after both of them. There was identified the key features of the syndrome, including the neurological symptoms, self-mutilation behaviors, and the associated metabolic abnormalities. Their contributions laid the foundation for understanding the genetic basis and biochemical abnormalities associated with this rare disease. Lesch-Nyhan syndrome is a rare X-linked genetic disorder that affects the metabolism of purines, which are essential components of DNA and RNA. It is caused by mutations in the HPRT1 gene, which provides instructions for making the enzyme Hypoxanthine-guanine phosphoribosyltransferase, that is HGPRT. This enzyme plays a crucial role in the purine salvage pathway, which recycles purines to be used again in the body. Lesch-Nyhan syndrome is a rare genetic disorder. The prevalence of Lesch-Nyhan syndrome is estimated to be approximately 1 in 360,000 to 5 lakh lives. Symptoms include self-mutilation, chorea, intellectual disability, cognitive impairment, aggressive or impulsive behavior, hyperuricemia, gout, and fatigue. One of the most distinctive features of Lesch-Nyhan syndrome is self-mutilation, where individuals may injure themselves by biting their lips, fingers, or other body parts. This behavior is thought to be related to neurological dysfunction. Individuals often exhibit chorea, that is involuntary, irregular movement, dystonia, that is muscle contraction, and other motor abnormalities. Cognitive development is typically delayed and intellectual disability is common in Lesch-Nyhan progress. Elevated levels of uric acid in the blood are characteristic of Lesch-Nyhan syndrome. This can lead to the formation of uric acid crystals, which may cause gout, which is painful joint and inflammation. The accumulation of uric acid can lead to the formation of kidney stones. In addition to self-mutilation, individuals may exhibit aggressive or impulsive behavior. Lesch-Nyhan syndrome is caused by mutation in Hypoxanthine-guanine phosphoribosyltransferase. It is a rare X-linked genetic disorder. HPRT gene located on X chromosome at 26.2 position consists of 9 exons and spans about 44 kb of DNA. HPRT1 gene provides instructions for making the enzyme Hypoxanthine-guanine phosphoribosyltransferase. This enzyme is essential for the purine salvage pathway, which recycles purine to be reused by the body. Mutations in this gene lead to a deficiency or complete lack of HGPRT enzyme activity. This impairment causes an accumulation of purines and their byproducts, leading to the characteristic symptoms of disorder. HGPRT gene converts hypoxanthine and guanine into their respective monophosphate forms, which are crucial for the recycling of purine. A deficiency in this enzyme leads to accumulation of purine metabolites, particularly uric acid. The HPRT deficiency causes an accumulation of purine and their breakdown products such as uric acid, which leads to the characteristic symptoms of Lesch-Nyhan syndrome. Diagnosis is typically based on clinical features, family history, and biochemical tests. Elevated uric acid levels in the blood and urine are indicative of the Lesch-Nyhan condition. Measuring HGPRT enzyme activity in cells or tissues can confirm the diagnosis. Identifying mutations in the HPRT1 gene through genetic analysis provides a definitive diagnosis. There is no cure for Lesch-Nyhan syndrome, so treatment focuses on managing symptoms and improving quality of life. Treatment options may include medications, behavioral interventions, and supportive care. Drugs to manage uric acid levels help to reduce symptoms like gout and allopurinol is the most commonly used medication to reduce uric acid levels in Lesch-Nyhan syndrome patients. Allopurinol inhibits xanthine oxidase, an enzyme involved in uric acid production, thereby reducing the amount of uric acid in the blood and preventing complications like gout. Another xanthine oxidase inhibitor, febuxostate can be used as an alternative to allopurinol for controlling uric acid. Due to the risk of kidney stone, it's important to ensure that the patient remains well hydrated and undergoes regularly kidney function monitoring to detect any early sign of damage. Restricting foods high in purines such as red meat may be recommended to help manage uric acid levels. Self-mutilation behavior are a hallmark feature of Lesch-Nyhan syndrome, and strategies to address self-mutilation and aggressive behavior may include behavioral therapy and environmental modifications. Drugs like clozapine or haloperidol may help reduce self-injurious behavior, although the effectiveness can vary from patient to patient. Clonazepam is used to reduce anxiety and help with movement control, potentially reducing self-harm behavior. In some cases, physical devices like padded gloves or mouth guards may be used to protect the user from injury due to self-mutilation. Although it's not a cure, some behavioral interventions may help manage or reduce the frequency of self-injurious action, especially when combined with medication. Many individuals with Lesch-Nyhan syndrome experience dystonia and involuntary movement. Medications like baclofen or dantrolene may be helpful in reducing muscle spasticity and dystonia. Botulinum toxin injections may also help to elevate localized muscle spasticity. Physical therapy, occupational therapy, and other supportive care approaches can help manage motor and cognitive symptoms. Physical therapy and occupational therapy may assist in improving motor function and mobility. Early intervention can improve quality of life and help prevent long-term complications from developing. Given the complexity of disorders, families may need psychological and emotional support to cope with the challenges of managing Lesch-Nyhan syndrome. Genetic counseling may also be helpful for family planning, especially for siblings who may be caregivers. Sharing is all about Lesch-Nyhan syndrome. Remember, understanding diseases helps us all stay healthy. Thanks for watching. If you found this video helpful and learned something, please like this video and don't forget to subscribe my channel Human Disease and Health for more health insights. Share this video with friends or family members to spread awareness. If you have any questions or queries, drop a comment into the comment box. Don't miss my next video. Until then, stay home and take care of yourself. Thank you.